Hi, I'm Layla and I'm a musculoskeletal and women's health physiotherapist at Physio Advantage with clinics in Birmingham and Hereford. I wanted to explain a little bit about what the Mummy MOT is and particularly what I offer at Physio Advantage with the Mummy MOT. So the Mummy MOT is a thorough postnatal assessment. So it's thought that research has shown that approximately 45% of women leak after having a baby. Approximately 25% of women still suffer some form of pelvic girdle pain, and about 35% of women have some form of a tummy gap rectus diastasis after having a baby. Now, the changes that our body goes through during pregnancy and childbirth are very significant. So we're looking at the changes to the pelvis that occur during pregnancy. There are a lot of structural changes that occur to the centre of our body, which is our pelvis. We have the ligaments that relax at the front joints and the back joints, and the muscles that control these areas also go through a considerable amount of stretch and change during pregnancy. As baby grows on our pelvic floor muscles stretch for those 9 months, whether we birth vaginally or via C-section. The pelvic floor have had baby growing on those muscles for 9 months. We've also had stretch through our abdominal muscles, through our centre here as baby grows and our abdomen expands. So that means that those muscles change in structure and therefore they change in function. So when we've had our baby, we need to address these changes in the muscles and the control around our pelvis so that we can effectively move our pelvis well, which is important when we go from sitting to standing and transferring weight from one leg to the other. So what we need to look at is in your Mummy MOT, we take a thorough history of your pregnancies, any past medical history you have, any previous injuries that you may have had or surgery that you may have had. Then make a list of your problems, your specific concerns, and then your goals. What type of exercises or function do you want to get back to? And then during your assessment of a Mummy MOT, I'll look at your posture and positioning, your breathing as your diaphragm is at the top of your core cylinder here. I will assess your pelvic floor function, and at Physio Advantage I can either do that by an internal examination of your pelvic floor muscles or using dynamic ultrasound imaging to look at your pelvic floor function. And then I'll assess your abdominal muscles. So I'll assess the general tone through your abdominal wall and then assess any widening through that connective tissue in the centre called the linea alba, which is often called the tummy gap, the rectus diastasis or divarication. And that's a completely natural thing to occur in every pregnancy, and it's represented by this little line here on the piece of band. As our abdominal muscles stretch, as our tummy stretches, that band gets bigger, and that's completely natural. But we need to make sure we get the tension back through that connective tissue as best possible postpartum. Then from that, I will devise your own personalised exercise programme, and at Physio Advantage I give you videos of your exercises, and then we make a progression plan to get you to reach your exercise goals and make sure you're exercising safely and effectively and functioning well, bending, lifting and twisting with your baby, strengthening up through your core so you control the pressure through your centre as best possible to minimise any risk of incontinence, prolapse, back pain and other issues that can occur as these muscles have weakened and altered in function during pregnancy and postpartum.